Hi, everyone. I'm here with Dr. Nicole Cain. She is a naturopathic physician as well as a certified psychologist counselor. Thank you very much for joining us today, Dr. Cain, to go over a really interesting case study where you used Omni-Biotic stress release.
Thank you for having me.
Absolutely. Can you tell me a little bit about the case and what the client came to you for?
Yeah, we'll call her Susie just to kind of protect her identity, but give her some nomenclature. And so Susie is a 51-year-old female, and she came to me after having several bouts with cancer, and it had wreaked havoc on her immune system, her digestive tract. She was incredibly stressed and overwhelmed, and very limited in what the conventional medical model could offer for her outside of just basic oncology visits and medications. And so she was looking for something different. And so I've been working with her for several years in trying to help restore the health to the nervous system, clearing obstacles to cure through detoxification, all of which were incredibly valuable. But what was pretty remarkable is there is this small piece of the puzzle, for her quite big, right? But there's this piece of the puzzle that hadn't quite shifted, and she was struggling with this gas and bloating that was fairly consistent, and she could manage it somewhat with diet, but it was always this kind of undercurring thing, and anxiety. And so we gave her Omni-Biotic, and within 2 days, her gas and bloating was completely gone.
Oh, wow.
It was absolutely amazing. And her mental emotional well-being is the best I've seen it, as per her report, my observations of her. And we also used objective self-assessment measures, which all reported that she's significantly better.
That's amazing and really wonderful. Had you tried other things to help her with her anxiety in the past?
That's primarily how she found me. Is my area of expertise is mental health and anxiety. And so we were working with her anxiety, and we've actually tried probiotics quite a lot in the past. And so it's not as though we hadn't been working on the gut-brain axis and her mental health. You know, she's tried medications, and we've used other natural supplements to support the hypothalamic axis, to support neurotransmitter health. But there was always this kind of underlying anxiety that wasn't clearing, and psychobiotics were a game changer for her.
Awesome. Did you do anything else in the treatment protocol slightly different when you added those probiotics?
That was the main variable that I changed. I try to be a little bit scientific with my patients, especially when they have a complex history like this, is I try to add one thing at a time. So add the probiotic, and then let me know how you feel. And then a week later, add something else in. And so there was something else within a week or two, but she saw improvements before the other items had been changed.
That's awesome. You mentioned objective findings. Did you do a questionnaire for her?
Yeah, we used the Hamilton Anxiety Rating Scale. We also did the GAD-7, and those both are anxiety assessment scales that are used under the Psychiatric Association. And then we used the PHQ-9, which is an objective measure that helps us assess depression. And it was really interesting. She actually sent me a message after I sent her those scales. And she said, and I didn't actually realize how bad my anxiety was until filling out these questionnaires. And then when she redid them 30 days later, she was like, oh my gosh, like, this is amazing. I feel so much better.
Can you share how they improved?
Yeah. So specifically, I'll open up the the Hamilton Anxiety Rating Scale. So she had a lot of high reports in insomnia. Sleeping was a really big problem for her, especially she wakes up in the middle of the night quite often. And when she wakes up in the middle of the night, her brain would start thinking about her worries.
Yeah.
So she reported moderate on that. And then that actually went down to mild. It was only a little bit, but I think there was also a stressful variable because her daughter had just moved. And so there was just some specific incident worries about that. She also had improvements with somatic symptoms. So that's item number 7, where she was saying yes to, I was having pains and aches and just muscle tension. She holds a lot of her emotional stress in her neck and her shoulders.
Don't a lot of people.
Yeah, it's like all of us, especially working on computers and having gadgets. And that was significantly better. When I spoke with her last time, that was actually gone. She wasn't feeling any of that. The ham also, number 11, talks about gastrointestinal symptoms. And again, the gas, the bloating, that when she filled it out originally, it was a pretty significant concern for her. It was a severe, and then it went down to none in 2 days, and it's maintained. So this has been a few months ago that she reported this transformation. And a really nice thing about it is it isn't just a honeymoon period, is she's been able to maintain these benefits for the past 3 months.
That's really impressive.
Yeah. It was like, sometimes I feel like people have this experience where I've tried everything and nothing is getting me over that hump. And sometimes it takes just a little push of the right thing. Mm-hmm. And I think the gut brain axis is oftentimes that obstacle. It's that place that we need to make that little push. And I think that Omni-Biotic has a really unique formulation where they've figured out how to do that, at least for this example. Like, it was exactly what she needed to, what feels like, get everything else that she's done and finally move it over that hump.
That's really wonderful. Have you considered switching her to something different, or are you keeping her on that stress release for now?
Right now, I'm like, girl, you are doing so well. Let's keep you on the same protocol. There's also the benefit of neuromodulation from sustained good feelings, right? And so we've seen in the clinical literature, it's like an average of 60 to 120 days, maybe closer to 90 days, for the brain to really start to remap based on our stress levels and our internal psychobiological experience. And so the longer that we can keep her feeling really good, the more her brain is going to integrate around that. The goal is that she could discontinue the probiotic over time, because the objective is that it's actually restoring health and restoring balance, so long as she's making good dietary and lifestyle choices. But right now, girl, we're not changing a thing. She's happy as a clam.
And did you do the 1 sachet or 2 a day?
1. Sure. All she took was 1 a day.
Oh, that's awesome. Did she have any, I know we get a lot of questions, and I know I've gotten funny looks when I tell people it's a powder and you dissolve it in water and then you give it a minute and then you drink it, and people, don't you just have a pill? And nah, aren't you tired of pills? Let's try something else. So did you have any of that with her or with any of your other patients that are on it?
No pushback. Actually, I find that people prefer the not having to take another pill. I feel like people are so frustrated with having to swallow down dozens and dozens of pills, and it's refreshing to just dump a powder in and go. They're easy to transport versus, like, if you do pills, you put them all in a Ziploc and cram them in your purse and hope they don't melt together. So nobody to date, of course, maybe tomorrow I'll get an email, but nobody to date has expressed any concern. And I've taken the product myself, and initially I was concerned that it was going to be a problem for the flavor, and it isn't. And I have another patient who has ARFID, which is a type of diagnosis where this kid has a really hard time with flavors and textures, and so it's really hard to get anything in him, and he can't swallow pills, and he likes this powder. So for me, if it's a green light from him, then I think almost anyone can enjoy the powder. Yeah,
I have some qualify as pediatric, but they're older pediatric kids who are on it, and they'll take it plain in water, but you can also, I've slipped it into other things, and they literally have no idea that I just altered their little protein shake or whatever it is. Like, they have no idea, their parents or myself, because I use it with my kids too.
Yeah. It's nice to be able to hide it so easily.
Yeah, definitely. Anything else you want to tell us about this case? It's super fascinating. It's amazing she had drastic results in 2 days.
Yeah, I was skeptical of that. We think about the placebo effect, and it's like, oh, there's this sachet and I'm taking this new thing in a placebo effect. But I've been working with her for many years, and we've had lots of time to get our placebo wiggles out. And oftentimes when I have seen a response like that, it doesn't necessarily sustain, and we are sustaining.
Mhm.
What I would like to do, and I'm really eager to see, is doing stool analysis testing and actually looking at the changes in her microbiome. And we have a baseline test from, I believe we have a baseline test from several years ago. And so that's something on my docket that I'm eager to do so that we have objective results showing improvement.
That would be really fascinating to look at, especially, I'm a lab geek.
Yeah.
So, like, ooh, let's look at the stool test results.
Yes.
Yay. And that combined also with the objective questionnaires, that's some really beautiful data that you are collecting on her.
Yeah. Yeah. And the other thing that we saw that I wanted to point out too is that, if people are feeling stressed and overwhelmed, they may not identify as having anxiety or having depression. There's just a sense of stress and overwhelm. And I actually talked with her about that because she is a high performer in her job. She's a pretty powerful career woman. And one of the other things that she did report is that she's finding that she's able to be more like a duck and that stressful things are rolling off her shoulders more easily.
Nice.
And so she just feels better. And so, yes, we want to improve gas and bloating, and yeah, we want to help with anxiety and lift her mood, but just that sense of like, I'm more myself and I'm not bothered as much by stress it's a pretty neat side effect.
Yeah. And there have been a couple of studies done, the fMRI one on this particular probiotic. And that was one of the things that the participants found. And I know for myself and the people I've used it with, that what I consistently hear is they usually phrase it as I'm able to roll with it better.
Yes.
And that's huge.
Yeah.
I like the duck analogy. It's just like water off a duck, it just rolls off. I like that. I'm going to use
Exactly.
it.
Exactly. I love it. It's so good. It's such a good product. And, there's other really awesome products that I looked at under Omni-Biotic. So there's the stress release, which is what she's using. But I know that there's other ones. There's like a gut healing protocol. And the reason that I selected this one in particular is because her main thing was her emotional distress. She didn't even know how bad it was, but I decided to pick a product that emphasized what she was looking for. And it's wonderful because as naturopathic doctors, our goal isn't to play whack-a-mole and just treat symptoms. It's to stimulate the body to heal itself. And I feel that that's what we're actually achieving. And so unless something changes, I don't see that we're going to be switching to anything different.
Oh, yeah. The gut brain axis, that whole HPA, and it's incredibly interesting and exciting to me as more research comes out on that and how much that impacts us in ways that we just really never even think about or have thought about. Everybody's always talked about this. I have a gut feeling, or, when I get upset, I can't eat, or food's upset my stomach or something like that. And now to be so much more in depth in the research and the literature and the knowledge to recognize, well, it's this altered microbiome and it's sending these chemical signals. And now you've got impaired permeability. And it's fascinating that now the science has caught up to, well, I have a gut feeling, right?
Yeah. Yeah. The book Psychobiotic Revolution was really eye-opening for me. And they talked about that, about how our deepest feelings and our cravings and our longings are literally signals, they're messages, post-it notes, requests from the bugs in our gut.
That's awesome.
Listening.
That's a really great book. I always forget to recommend that one. So thanks for the reminder on that one.